There is always a chance of bleeding, so no matter what you do or don't do. Welcome to Medical Made Easy. Today we will discuss prostate biopsies. We won't go into the reasons why the decision was made to have one, but if your urologist has recommended one, we will talk about how to get ready for it and what to expect both during and after. So let's get started. There are a few common reasons to get a prostate biopsy. Either you need to diagnose prostate cancer because you're worried that it might be present, or you're following a diagnosis of prostate cancer that was not initially treated with radiation or surgery, but it is being followed, in which case you need to have a biopsy to confirm the results. The main reason is usually because you are going to be diagnosed with prostate cancer or not. So let's talk about the biopsy. These days, there are very good scans like psma PET scans that can be done to show if there's recurrence at the prostate or if it was radiated or in other areas, if it's the same aggressiveness or not, and if you had radiation for prostate cancer. Sometimes they can do a biopsy to confirm if there's a local recurrence of cancer. How is this done? Well, it's done in the office. So unless you're using non-steroidal anti-inflammatory medications or particular blood thinners, there is no need to fast or stop taking your medications. Therefore, there will be extra preparation needed for that. How is the biopsy performed? It's typically done with the aid of an ultrasound or sometimes an MRI. The ultrasound allows us to measure the prostate and looks at areas that we might not be able to feel. But the picture allows us to see them and target them a little bit better. If an MRI was performed and the results indicated any problematic regions, you could, if you have determined that a prostate biopsy is necessary. Let's discuss the dangers. This procedure is known as an MRI fusion biopsy, which uses an MRI image to view the printed together and truly target those areas. What are the biopsy's risks? The primary one is bleeding infection, or what's known as retention, that you can have later on. Now let's talk about how to get ready. There is always a chance of bleeding, so no matter what you do or don't do, it is imperative that you stop taking any steroidal anti-inflammatory drugs like Advil, ibuprofen, or Motrin about a week before. This also applies to aspirin, which many people take daily for heart problems. If you're taking blood-thinning medications, you may need to schedule your appointments differently. When to hold it anywhere shorter, 3 to 5 days to be exact, depends on your risk and what your primary care physician, cardiologist, or urologist recommends. Please consult them to find out when to quit those medications and extremely rare circumstances. Sometimes you can continue taking those medications, but only under your doctor's supervision. The other risk we discussed is infection. So it's crucial to have your urine checked to make sure there isn't one, and to take an antibiotic before your procedure. Your urologist will determine how long to take the antibiotic and when to start, so it could vary. But generally speaking, an antibiotic would be given before the biopsy, the night before, and occasionally during the procedure itself right before. So that will help to minimize the risk of infection in some cases. Alternatively, some people perform a rectal swab, in which they obtain a culture from their rectum and analyze the results to determine whether the antibiotic they would give you would be resistant. And they try to tailor to put the right one right before your procedure. Not everyone does that, but it could be done. The other risk of bleeding, infection, and retention implies that you won't be able to urinate after the procedure. This usually occurs if your prostate is already enlarged and you have many symptoms associated with it, such as difficulty urinating frequently, urgency, or weak flow. You may also be taking medication, such as Flomax, finasteride, or testosterone, to help you urinate more easily, but regardless of the size of medication you may be taking, this is a risk that it is unlikely to occur again. In order for the biopsy to be ready, we need to make sure that we stop taking any medications you may be taking. This means you should only take non-steroidal pain relievers or anything that thins your blood. We also need you to take your antibiotics and attend your appointment on a regular basis, which means you should not fast. Remember that you can drive home after the procedure. Now that you are there, what to expect from the appointment will vary. But frequently, the urine will be checked beforehand to ensure there is no infection. It usually is a good idea to know how well you are emptying your bladder before you start the treatment, as they will check to see how well you empty it to get a baseline. To know where you were before the procedure in case there are complications later on, where you cannot urinate. Additionally, they will examine each and every one of your prescriptions. Make sure you did not take anything you shouldn't have, and they'll probably give you an injection of an antibiotic first. The hardest part of the procedure is getting you in the right position, which is typically lying on your side, with your knees bent to your chest and away from the doctor. Next, they usually inject some numbing jelly into your rectum followed by an ultrasound. This allows them to measure and view the prostate more accurately than they could with just a finger exam. After the numbing medication and ultrasound have been administered, they usually give you more numbing medication. This injection causes a burning, tingling, or slightly uncomfortable feeling, but it will numb the surrounding nerves, preventing you from feeling anything after that. However, it is common to feel pressure once everything is numbed up. The urologist will measure the prostate and look at any areas that again may look abnormal. Typically, this looks like a dark spot, so you won't be able to see it. Once everything is numbed up, we proceed to get samples or biopsies. Normally, 12 samples are taken. But if your doctor feels something abnormal on that rectal exam, or if something was seen on ultrasound while it was being measured, more samples will be taken from these areas. Because of this, the rectal exam is crucial. It not only tells us the size, but it also feels something that is typically a sign of prostate cancer. So we should absolutely take more samples. The entire process will take approximately 5 minutes, and the entire appointment will probably take 30 minutes to get you situated, ready, and checked on. After the biopsy, your blood pressure will often be checked to make sure everything is normal and that you are feeling well. Vasovagal reactions, which can cause a reduction in your heart rate and blood pressure, can occur in certain patients, and you feel dizzy. Usually, this goes away after you sit up or drink some water. However, it can happen. It's not dangerous, but it can be noticed. So, what you should expect after the biopsy and what's normal or not normal. After the biopsy, it's normal to have blood in your stools for a few days. After that, it should really start clearing up every day. It's also normal to have changes in the color of your ejaculation. These changes can last up to 2 months, so just be aware that they could be a range of colors such as rusty, pinkish, burgundy. It should definitely clear up if you have merely taken Tylenol over the counter. For any minor discomfort, you might experience it, but you shouldn't need to take any additional pain medicine after that. Make sure to take all of your home prescriptions and your antibiotic on the night of the biopsy. What to do or expect following a biopsy? It's crucial that you avoid hard lifting and vigorous exercise as well as ejaculate for around 48 hours before bed. Be mindful when riding a bike because you will essentially be sitting on the prostate's perineum. Take it easy for the following 2 days or until your biopsy, and then resume taking all of your recommended home medications. When should you call the doctor or be concerned about something not going well? If followed the procedure, you have a fever of 101 or higher or chills, you should call your physician because this is likely an infection and you may need to have IV antibiotics and fluids. Call your doctor or go to the emergency room and let them know you just had a biopsy. Generally, you want to wait 1 or 2 days until there is no more blood seen before you can restart it safely. If you have blood in your stool or urine, you should also contact your doctor or go to the emergency room. If the blood in your urine doesn't go away, it can clot and prevent you from urinating. In this case, call your urologist, return to the office after hours, or go to the ER. If you are unable to urinate, a catheter will need to be placed to drain your bladder. If all goes according to the plan, you should receive the results in about a week. At that point, you can discuss them in further details with your physician. Keep in mind that the objective of this is educational. Always discuss with your physician any particular concerns that are significant to you, as each person's needs are unique and will vary. If you liked this video, please give it a thumbs up. Also, what do you think about the information conveyed in this educational video? Please let us know in the comments below. Until next time, take care and bye-bye.